Thanksgiving is a time that we all give thanks. We indulge in a lot of food, and we spend time with family from all over the country, friends as well. But there is pressure, not just around the holiday, but certainly now to stay healthy while you're preparing for all of this over the next 6 weeks. Doctors are warning that holiday gatherings can bring an increase of the tripledemic, where we can see the flu, COVID-19, and RSV cases overwhelming hospitals. Here to talk more about it, Dr. Leah Croll, neurologist at the Lewis Katz School of Medicine at Temple University. Dr. Croll, thank you. Happy holidays. So as we get ready to join our family and friends around the dinner table, there are some tips to follow to prioritize our health. What would be at the top of your list, and what should we be thinking about?
Happy holidays, Marni. So, number one on my list is check in with your doctor and make sure you're up to date on all your vaccinations. It's a lot to keep track of, but flu, RSV, and COVID all potentially have vaccinations depending on who you are and how old you are. So that's the best layer of protection you can give yourself. The other thing to think about here is that traveling in this really congested, busy time is going to be a high-risk period for getting these viruses. So I want people to really keep their guards up, have that mask handy when you're going through the airport, when you're on the plane, when you're at the train station. Make sure you're being diligent about washing your hands. And of course, if you are going to be staying with or in the, indoors with high-risk people like the elderly, the young, immunocompromised folks, or pregnant women, then you really want to consider testing before potentially exposing them to a harmful virus.
Clean hands are happy hands, right? If you're sharing snack food, everybody's dipping their hands in the bowl. Be cognizant of all of that. Lots of people are going to be drinking more over the holidays. Some of the people may be doing it to get through the holidays, but what's your advice on alcohol consumption right now?
I want to validate that alcohol is for many people a part of celebration, and also for many people the holidays are stressful, and it makes sense that you would feel like drinking more in that type of setting. But I do encourage people to remind themselves of what the recommended healthy limits are for alcohol intake. So for men, that's 14 drinks per week, and for women, that's 7 drinks per week. And I'm saying per week, so that means you don't want to have all of those drinks in one sitting. You really want to pace yourselves. And I often advise my patients to go into your holiday party or holiday gathering kind of in your mind with a plan. I'm only going to have 1 or 2 drinks tonight, and make sure you're spacing out your drinks with lots of water or other healthy non-alcoholic fluids in between.
Yeah, so alternate wine, water, whatever your drink of choice may be. You'll appreciate it the next day, that's for sure. Drugs like Ozempic and Wegovy have been in the spotlight for reducing how much people can eat. I'm hearing more and more people on these drugs. Some are searching online, wondering about the risks of them. As we get ready to eat, what is your messaging and the warning about these drugs and who's taking them?
A couple of things here. These drugs work by reducing the amount that you're really able to eat and that you want to eat. And so you might not be getting your typical Thanksgiving portions this year if you're on Ozempic or Wegovy. If this is a newer drug to you, you've only been on it for a couple of weeks or a couple of months, you probably do want to check in with your doctor and just come up with a game plan of signs to look out for if you're overindulging and, really having bad gastrointestinal side effects as a result of the combination of that indulgence and the medication. But portion control here is going to be key for keeping yourself comfortable. And of course, it's okay to explain to friends and family members that you just can't eat as much as you normally would now that you're taking this medication.
Right. Fill up your plate with small portions, and then later in the day, go back for seconds. The food's not going anywhere. All good advice, Dr. Leah Croll. Thank you. Happy holidays to you.
Happy holidays.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.